It's about cancer screenings.
Yeah.
It's about annual wellness visits, access to contraception, behavioral health services.
Hi, it's Congresswoman Kelly Morrison here with my dear friend and Planned Parenthood North Central States CEO, Ruth Richardson. Obviously, we both have huge concerns about the impact of this cruelly named, in my view, One Big Beautiful Bill Act that has now been signed into law by President Trump. Can you talk a little bit about the implications of this new law?
We remain in a place of manufactured chaos right now, and this bill is coming on the tail of more than $2.8 million being frozen by this administration to Planned Parenthood North Central States. So we're in the space where there are just so many barriers that our patients are experiencing.
Planned Parenthood provides essential health care and primary care for a lot of people, but it also has filled in the gaps for a lot of people in our fractured healthcare system. And one of my big concerns with big cuts to Medicaid, if this attempt to defund Planned Parenthood persists and ends up being successful, what that will mean for patients.
We're an important part of the safety net network of healthcare providers, and that safety net was already fragile before this bill passed. And so when we think about what's at stake, it's about cancer screenings, it's about annual wellness visits, access to contraception, behavioral health services, STI testing and treatment. We are also in the space of recognizing that we are constantly having to pivot and
Mhm.
reimagine. And with that, we have expanded services and ways to ensure that we're reaching more patients with primary care services. We're doing work to expand into maternity care services,
Amazing.
prenatal and postnatal care, menopause care, fertility services and treatments as well. And so, in this space, we're here for our patients. We're doing everything that we can to ensure that the services remain accessible and affordable.